Okay. All right. So I'm going to go ahead and let's see. Screen. Okay. If people can just chat me and tell me if they're seeing the screen, the presentation, that would be really helpful. Awesome. Okay, people are seeing it. Excellent. All right, we're going to go ahead and make this bigger. All right, so just to start off, this is a picture of our group from this past summer, all of our interns, amazing interns, and a few of our staff that was working with them as facilitators, instructors, and preceptors. So we wanted to, just start out this conversation of this info session to talk a little bit about the topic that we sort of shared with some of you in introducing this call. We feel it's really important for people who are thinking about going abroad, who are going to have some kind of experience outside of their own culture and volunteer, that it doesn't become a situation where you're going to help, but in the end, there's some kind of extra burden that is being put on the communities that you're actually going to help. So there's actually an article that we were looking at in preparation for this call that was in the New York Times last year, and it used this term of volun-tourist, someone who is volunteering but touring the world. So we have a little definition of what is a volun-tourist. So I'm going to go ahead and read that, but this is not necessarily an official definition. But so short-term visitors to other countries trying to help the communities they encounter, but who go with a sense more of tourism and whose work doesn't necessarily benefit the communities that they go to long-term. And the benefits end up being a lot more for the people who go on the tourism visit than the people they're going to help. So we want to talk about several key concepts, and I'm going to turn it over to Jess, that we strive really, really hard to make core values and live them out as AMOS, and that we teach and experience as a part of our global health practicum and internships that we offer.
So we're going to touch on 3 major topics about how to avoid becoming a volun-tourist, no matter what kind of projects you're engaging in this summer or what volunteer work you might engage in the future. And so the first concept we want to propose is cultural humility. And so this helps build relationships in the field to empower and contribute to real change. And so there are 3 main tenets to cultural humility. And the first one is lifelong learning. So no matter where you go to volunteer or where you decide to do a practicum this summer, just remember that you are a lifelong learner. That, for example, we've had Christy living here in Nicaragua for over 5 years, and she still has this attitude that she has more to learn. She does know the culture, but there's no way she'll ever learn all there is to know about Nicaraguan culture. So she has that humble attitude and moves forward.
You're really sweet to use me as an example.
And then the second tenet for cultural humility is recognize imbalances of power. So as you volunteer, just remember to see yourself as a foreigner who is coming in to a community, and with that weight, you are bringing with you a lot of power and privilege to the communities you're serving with. And finally, the third tenet is institutional accountability. So you want to look for organizations that are working with the community leaders, and they're working with the government. For instance, here at AMOS, we work really closely with the government to hold each other accountable. So they're holding us accountable, and we're also working with them very closely and providing a lot of materials for them. And then this brings us to something we like to call critical theory. And so that means to understand another person's reality, we must learn to deconstruct our own reality. So we engage students here at AMOS in critical theory, which is really a set of questions that ask students to dive deeper and to understand the root of a problem. So where you decide to volunteer or do an internship, really think about the root problem, like where the problems generate with whatever you're trying to address. With that kind of goes back to what we were talking about of being a lifelong learner, also realizing what you're bringing in to the place that you're going into, realizing your power and your privilege, and even thinking about the institutions of the United States and the power and privilege that they bring in as well to a lot of foreign countries. And so this brings us to our third tenet of becoming, of learning to not become a volun-tourist, and that is a reiterative cycle. So when you're going to a community, you want to walk alongside them, adapt certain methodologies, especially here at AMOS, we adapt a lot of public health methodologies to each of our communities because everyone is completely different within all of our communities. We learn from our experiences, and we are lifelong learners. We share what we've learned and the data that we've collected, and then we grow and we repeat the process. And this helps us to have a long-term impact. And here in the pictures on the slide, you can see these are a lot of our volunteers from this last summer, and they're sharing back the data with the communities. So that's a really important thing to look for in an organization, is someone that is really engaging the community in the research process and making sure that they leave the data with the community so that the community can grow and use it to move forward.
And we're going to be talking about this a little bit later in the presentation, but I think the other aspect that's really great that isn't just the impact in the community, but is looking at how the long-term programs that AMOS has ongoing, not just in the 1 or 2 communities where the volunteers and interns might visit, but also across the board, all of our communities, the kind of data and tools and innovations that the volunteers make a contribution to affect and impact have a great contribution to help all of our communities with these ongoing programs that people plug into. All right, so after that little introduction about volunteerism and trying to avoid those pitfalls, we just want to say, we don't know exactly why each one of you are here today, but we have a hunch that if you're on the call, you probably have a desire to find some kind of experience where you can make an impact and you can really connect in a meaningful way with people from another culture. And that's something that we really are interested in helping all of you do, even if you don't choose to, come and work with AMOS this summer. Wherever you go, we really hope you do find that kind of an experience. So some of you may already have some knowledge or have, done a little background research about who we are, AMOS Health and Hope. But I wanted to talk just a little bit about who we are as an organization and about Nicaragua, the kind of work that we're doing here. So AMOS actually was founded by 3 doctors and public health professionals. Dr. Laura Chenchim Parajon, who is the main person featured in this photo. She founded it along with her husband, David Parajon, and her father-in-law, Dr. Gustavo Parajon, who was Dr. Gustavo was a pioneer in global health, in community health here in Nicaragua in the rural communities. But they really saw this quote, I'm not going to read it all, but basically, as doctors, the belief is that like you can have much higher of an impact if you're also teachers. It's not just one clinician who is seeing patients, but is teaching others who are local leaders who can help provide the healthcare that people really need in these really remote places, which is where AMOS is focused on. And so that leads into our mission, which is really the improving the health of impoverished communities by working alongside them in health education and development. And it's a theme that we're going to come back to just like over and over, but that working alongside them, it's not just some empty words. We really try to integrate it wholly in all of our methodologies, and that sharing the data back with the community, like Jessica said, is a really important piece. So where do we work? AMOS works in 22 rural communities with our community-based primary healthcare model. We have one semi-rural, semi-urban community in the area of Managua where our home base is located. And we have a growing program in maybe expanding to 10 different health centers in the country doing something called Essential Care for Every Baby. So we have several different projects going on. We also have a Zika prevention project that's expanding our work in the urban areas. But we have basically, excuse me, 6 different departments or regions where AMOS is located. And this is just a really quick like bullet point list of some of the programs, the main programs that AMOS focuses on as a public health organization. So community-based primary healthcare is kind of the general model that we use. We have a nutrition program, a WASH program focusing on access to clean water, sanitation, and hygiene. We have a youth empowerment and a women's empowerment program. We do that Essential Care for Every Baby project that I mentioned. We have an urban community health focus as well, and the newer, more recent project that we're working on, which is prevention of Zika and using a care group strategy. So we don't have time to go into all of that today, but some of these words might be familiar to some of you or get you excited about things that some of our interns, become a part of. And I did want to share, just one really important piece of data for us that is really one of the key things. Our mission and our vision really is creating a world where no child dies of a preventable disease. And so this is, some of our data from 2012 to 2016. So 5 years of data and showing the collective decrease in deaths of children under 5, which is a really important target group for us. And so this is data that shows like there's been a decrease of like 90% in child deaths in all of the regions that we've been working in. So we just wanted to share with you because all of our programs, like this is really one of the main end goals for us that we're working towards. All right.
And so that brings us to the Global Health Practicum and internships. But before I get into that, I did want to say a small word about our staff. So right now you're seeing Christy and I, and we are some of the foreigners who work for AMOS, but our staff is actually about 60 people, and the grand majority of them are Nicaraguans. So I just wanted to tell you guys that you're not seeing really an accurate representation.
About 5 or 6 of us that are not Nicaraguan.
So yes. So like I said, this brings us to the Global Health Practicum and internships. So we have developed these options because we noticed a dramatic increase in the number of students who are wanting to visit AMOS over the years. And initially, we had them coming at various times of the year. And so we wanted to formulate a program that would really, channel their energy and their power into our sustainable projects. And so that's why we have developed this program. So we have 3 options for students to participate with us. The first is the Global Health Practicum, and this is going to show you a breakdown of the number of weeks. So in the Global Health Practicum, that is 3 weeks. And the first week, we will be here in Managua. We teach it's a classroom week where we teach our methodologies. So we'll go over community-based primary health care. We'll talk about community health workers and community-based participatory action research and how to do community empowerment to get students ready to go to the field, which they go to the field for the second week of the practicum, where they really see our initiatives in action. The third week, the students will come back to the urban area of Managua, and that week we really focus on hard public health skills. So, for example, we'll be teaching about the application of community-based participatory action research, and we'll also be teaching students how to teach to low literacy settings. And so we like to really hone in on those hard skills as well. And then we have the capstone and internship options after the global health practicum. So all of our capstone students and interns must take the practicum because we really want to share our methodologies with them, and so that they have a really solid foundation of what AMOS is and what we do. So students can stay on for the capstone for an additional 3 weeks, where they'll be working on a project, and then we also have the internship program, which is for an additional 5 weeks after the global health practicum. And so in the practicum, you will be getting 120 hours of hands-on public health training and field work. And so I kind of covered a lot of this in just a minute ago, but these are some of the learning modules that we cover. So like I said, we'll be talking about CBPR, power and privilege, and how we recognize that in ourselves, and especially as foreigners coming into a different country, how we can cope with that and be culturally humble people. Like I said, community empowerment. We talk about the social determinants of health. We have a history lesson from a really amazing Nicaraguan historian, and she gives us, a flash history lesson. And then we go into those hard skills like biostatistics and teaching to low literacy settings. And so within the capstone and internship program, these are the projects that we had last year. And so I'll kind of share what the interns and capstone students did last year, and also share what we're projecting our projects to be for this year. So last year, the Women's Empowerment Internship went to one of our most remote communities called La Danta, where they conducted a barrier analysis. And so a barrier analysis is essentially a survey that really targets the different health behaviors and unearths the barriers for people participating in those good health behaviors. So for instance, in this case, we noticed that there was a really low rate of people achieving 4 or more antenatal care visits. And also here in La Danta, the women do not make it. A lot of women don't make it into the health center to deliver their babies. So they're delivering a lot of home births. And so our students went in and knew that these were big problems and found ways to unearth what those barriers were. And so some of the major barriers that we found were, having the husband involved. If the husband was more involved in the antenatal care visits, the women were more likely to achieve them. If the women had a reliable transportation network, if the women felt that their healthcare providers were supportive and were there to be with them and not berate them, so things like that. And we've really used that data in our programming for the year.
And just one comment: the context of this community, it's not like in the United States, a home birth where you're 5 minutes away from a hospital. This is a community where you literally have to ride on a boat down a river for a while, and then walk to get a public bus, which is hours ride away from the closest health center, not even hospital, where they're fully equipped. So just to give you guys just that kind of context, these are really, really remote communities.
Yeah, and this one is 6 hours away from the nearest health center, so it's really far. And then we had our youth empowerment program. So this year in 2016, the youth empowerment team worked to take a baseline survey for our program. This is a relatively new program for us, and we're working on expanding it. So they realized they did a lot of surveys based on youth knowledge around risky behaviors and sexual behaviors and alcoholism and also school attendance. So they did a really great job developing a baseline for us. And so this year, where we see the youth empowerment internship leading, they will be most likely rolling out a family planning program that we're piloting early this year in May. So that's what they'll be doing, and they'll also be measuring this program against a control site. So it will involve a lot of research. For our urban health programs, last year we had the Zika capstone. And so we have a special guest on the line, which she'll share more about this program in a little bit. But for this program, we had students going out and doing surveys for us, some more barrier analysis surveys regarding family planning and condom use. And so they collected this data because we were applying for a USAID Zika grant. And they did such a wonderful job. We used their data within our grant, and we actually got the grant. And so now we have a 3-year strategy to do community-based Zika prevention. So they were just such a great help to us. And so this year, we will have a capstone project in the Zika area again. They'll be doing a lot of work with our program that is being rolled out right now, doing a lot of survey work for us and measuring the effect of our programs. And then we'll also have a chronic disease internship. We have really, really high rates of cardiovascular disease, and diabetes here in the urban areas. And so they'll be taking some baseline data for us this year. And so now we would love to get Sara, one of our 2016 participants, on the line in just 1 second.
Hi. Can you hear me?
All right, Sara, go ahead and say hello if you can.
Hello? Can you hear me? Can you hear me?
Yeah.
Yes. Hopefully. Yeah? Okay, awesome. So I'm Sara. I'm a junior at Harvard University, and I'm studying the intersection between anthropology and psychology and focusing on global health. And I was an intern last year for the capstone project through AMOS, and I really, really, really loved it and enjoyed it. The reason I was looking into AMOS was because I was interested in public health and knew that health inequality frustrated me, and health inequities was something I really cared about, but I didn't realize how much I cared about it. And when I found AMOS, I was looking for something, an organization that was really focused on cultural humility and cultural sensitivity, and also on cultural sensitivity, and both integrated community health workers into their programs and were also sustainable. And like Jessica and Christy said, AMOS, those are part of AMOS's core values. So that's why I initially chose AMOS. And because I was in the capstone project, I was working with the Zika and the Zika education, the barrier analysis program. And through that, I realized the importance of connecting with people and learning from people, and how sometimes you learn more than you can give. And that really, really motivated me to continue public health and get involved in public health in the future. And then using those skills now, because through the public health and barrier analysis work we did, I realized how important qualitative research is and how important it is to let the community make the decisions for you. And there was a quote that we learned about in regards to liberation and why people do this work. And it kind of focused on how if you have come to help people, then you're wasting your time. But if you have come because your liberation is found in the liberation of others, then we can work together. And I realized that that's kind of how I want to live my life and work towards my life. And I'm using that right now because right now I'm working on my senior thesis, and I'm using the values and lessons and the methodology I learned through AMOS and applying that through my thesis. I'm working with very similar things like care groups, but focusing more on mental health. And so if you really, really want to get really immersed in public health and learn about the people and the culture, but also important things like cultural humility, I really, really encourage you to apply to AMOS because it can really, really change your perspective on not just the world and people, but also public health.
Thank you, Sara.
Thanks,
Sara. We missed you.
We miss you too. I miss all of you guys and the staff and like everyone you meet. It's absolutely incredible. I still keep in touch with like almost everyone that I met through my internship. It was a wonderful experience. It was really great.
Thanks, Sara. That's
Come
awesome.
Back.
Yeah. We love volunteers. Come back.
If you ever, I know I will. I really want to, and I'm looking into applying into a Fulbright next year to come back to AMOS, hopefully.
Oh,
we'll see.
Please.
Yeah, because I can't get enough of it. So, and if you have any questions, you can get my information from Jessica or Christy. I'd love to talk more about it.
Yeah, can you actually stay on the line for the Q&A part?
Oh yeah, of course.
Okay, awesome. So I'm gonna put you on mute, but we'll have Sara around as a past volunteer if anybody can if it has a question for her later. All right, so we have just a little bit more to like give you guys just kind of the final information about the application process and the cost of the program, and then we'll open it up for questions. So right now we're pretty close to our deadline for applications. There's several steps in the process. So as long as you get your foot in the door and kind of start the application process by February 1st, some of the pieces you might not have totally completed by that date, but that's okay. So we really encourage you, if you're interested, reach out to us and start your process. I'll just say the point that, Jessica mentioned before, but the Practicum 3-week course at the beginning is a requirement for all of our students, participants who want to be a part of the capstone or internship extension after that. So I think Milvia is on the line. Milvia is our volunteer coordinator, and she is amazing, and she is the person who's kind of helping walk all of our applicants through the process. So this is her email, volunteer.coordinator@amoshealth.org. So if you're interested in applying, Milvia is your girl. Okay, so this is a breakdown of the cost of the program for each of the 3 different options that we've talked about. So food, lodging, and in-country costs, the project costs, which relate to the actual work with the programs and all the materials and transportation and the preceptor time and translation and all the kind of stuff that goes into all the really a lot of work in prepping the communities and etc. So there's a lot that goes into it. And so the 3 price points that are for the different options, it's $2,400 for the 3-week global health practicum. It's $3,900 for the 6 weeks and $4,900 for the 8 weeks global health practicum and internships. As you can see beneath, there's a couple of points that we'll just kind of touch on. These are pretty all-inclusive costs. It includes everything that you will need except for your airplane ticket. And it doesn't include if you want to go on your weekends off to do a tourist activity, go to the beach, that kind of thing. Nicaragua is a really beautiful place, so we do recommend that, but that isn't included in the cost of the program. there is one kind of, I don't know if you want to mention anything about that.
So after the week that we go to the field site for the global health practicum, that week number 2, we do have a retreat where we'll go to probably a really amazing lagoon that we have here in a beautiful colonial city.
Volcanic crater lake.
Yes, a volcanic crater lake.
Yeah.
It's beautiful. So we do have one trip planned in there. But last year the students were traveling literally to all sides of Nicaragua on their weekends, and it was amazing to see all the things they got to see.
Yeah, and we do. I wanna touch on the last point, which is related to funding. So this is a really, really amazing program with people precepting who are professionals in public health. This is like qualifies for a lot of people. Their programs, they have to do some kind of practicum if you're doing a master's in public health. Or for some other programs that are undergrad or in medical school, there's a lot of different programs out there that kind of require this sort of fieldwork experience. We have found that the very large majority of our students are either applying for funding from their university or college. That's part of why we have the application deadline when we do, because a lot of the sort of grants or funding opportunities out there, they need you to get in your applications around this time or like early March. So we're trying to adapt to that, and also a lot of people do some fundraising too on the side from family or friends or their whatever communities they're a part of. And we are definitely. Oh no! Okay, hold on one second. Shoot. Sorry, guys. What is happening? Okay. Wow. Okay. So sorry, you guys. Okay. So I'm going to go really quick back through this. I'm assuming that after Sara talked, we kind of lost the screen. So let me go back. I'm not going to repeat all the information, but here's the deadline, February 1st. Here is, can everybody see the screen now? Is it working? Now it's working. Okay. Yay. Okay. Thank you, Milvia, for letting us know about that. So Milvia's email address, once again, if you're interested in applying, volunteer.coordinator@amoshealth.org. And so, okay, here's the screen again. So I apologize that this was not up here while I was talking. So hopefully this helps give people, I'll leave that up for like one more second, take a clean screenshot or whatever. But this is all information. This is not, this is published on our website with the information that you can download and read there. So this call right now is not the only place you can find this information. And we'll be sending all you guys to a link to the recording from this afterwards as well. Okay, so I think everybody should still be able to hear me, and we are looking at the chat box. So please go ahead and chat us if you have any questions, and I'm going to unmute Sara as well, and just in case anyone has any questions for her. Okay, we have a question from Danielle. Do students stay with host families? Jessica, do you want to answer that?
That's a great question. So we don't have students stay with host families. When we're here in the urban center, we have, and we'll be happy to share this video with you, we have 2 amazing guest houses where our students stay. And so these are dormitory style accommodations, and it's right by where you eat your food in the morning, and it's on our campus. We have guards here as well. So that is where students stay when they're here. As for when they go to their rural communities, they'll be staying in kind of a variety of places. For instance, last year we had some students that were staying in a school a local community school, some staying in churches. We had a couple of people did stay in someone's home. I think actually Sara was one of those people. But for the majority, we're staying in public areas and then on the AMOS compound. Thank you for your question.
Okay, we have a question for Sara from Simone. How were you able to finance your study abroad time?
Hi. Hi, Simone. Wait, Simone, right? Okay, so I actually applied for funding through my university. They had an independent scholarship for students that were going into global health work or research. So I applied for that. It was a little bit of a tedious process, but they ended up giving me enough money to cover my flight and the program fees as well.
Okay, great, Sara.
Thanks, Sara.
Thanks for asking, Simone. So we have several questions coming in. I hope we can get to all of them. So, not sure if I'm pronouncing your name right, but Fahad is asking about access to having reliable internet access.
That's a great question.
We're actually at our office right now. So.
Yeah, so that's a great question. And Sara will have an interesting story to tell you. So we just got, I'm going to totally butcher it, but like, I don't know, we just got faster, more reliable fiber optic cable.
Yeah, so we have better internet now than we used to. There still are moments where there's some issues sometimes with the service, just like there can be in the United States, but overall it's very reliable. Really and all of our students do have access to that when they're in Managua. When you're out in the rural communities, there definitely is not no Wi-Fi, and so
no cell service either.
No cell service, yeah. So you're definitely like pretty far out there for that part of it. But when you're back in Managua, there are kind of like some work weeks worked into it, and yes, there is internet access. Okay. The next question is from Daniel K. I'm a first-year medical student, and my wife recently graduated with her master's in speech-language pathology. Would both of you be eligible to participate together? Yeah, I definitely. So I think that definitely the program is open to anyone from any walk of life, really any age range. You guys can kind of see in this picture back here, but we actually had a couple of participants last year who were sort of doing a second career or like just getting some continuing education in their field. And so I think it's a really great program. And we've also found, I wouldn't say like, I've been with AMOS for 5 years, and a lot of our partners, a lot of them who are churches and people who come, not all of them are public health professionals, but we found a lot of interest from people from tons of different backgrounds and just understanding more of that kind of community-based side of things. So yes, you definitely would be eligible to participate. I think,
yeah, and just one word, we are a public health organization, so speech pathology is less an area of expertise that we focus on, but we would love to have diverse people. We've had so many amazing students. We've had economic students work with us, medical students, education, just like tons of varieties of students come through. So we would love to see that, but there might not be any specific speech language projects to work on.
Yeah, definitely for the internship, that would be a harder thing, but for the 3-week course, absolutely. Yeah, and if you guys are both open to working on the types of projects that we have proposed for internships, yeah, more than welcome. All right, so Amy is asking, do students get to choose which project to work on?
That's a great question. So it kind of relies on a number of different factors. We do have students rank which internship projects they would like to work on. However, some of our, we're going to be having most likely be having 2 rural internships that are going to require a really high level of Spanish. So we will ask students to preference, but we will definitely be saving the 2 rural internships for high-level Spanish speakers. And then And it also will depend too on the time that you're available. So if you aren't able to participate the entire time of the internships, we will probably ask you to participate in the capstone if that's something that you're looking for. So thank you.
Okay, which one did you just finish the choosing?
Yes.
Or the, okay. So then we had a question from Brian and Katie. Were you able to receive course credit for your time with AMOS? I'm assuming this is a question for Sara. I'm a first-year MPH and was hoping I could register with my university for independent study. Yeah, do you want to answer that too?
Yeah, I can take a stab at that. So actually, I would say the majority of our students last year did receive school credit for this MPH. So they did go like a bunch of them were MPH students, and so this counted as their practicum credit. But we did have a few others who were undergrad students who did sign up for an independent study and got credit through that. And because we have medical doctors, we have MPH staff, we have people working on these with advanced degrees and a lot of experience. We've been able to proctor that course for them.
Yeah, good question. Rachel had a question for the internship. Can we start out in the capstone and then work for the first 3 weeks if we are interested in the work with Sika? I'm not sure I totally understand your question, Rachel, but the capstone project option is the first 3 weeks of the practicum plus another 3 weeks in country.
So
and 6 total weeks, and we pretty sure that project is going to be with the Zika prevention. So hopefully that answered your question, but
I think I did understand. So I think it was, could you start off in the Zika and then continue on to work with other projects? So I think that's something as a staff we would have to discuss, and we can get back to you on that when we discuss it. But we have had a lot of interest in our internships and capstone projects this year. So it looks like we're going to be working with a really full group. So I don't know if we'll have that leeway to do that. But that's something we'll discuss as a group.
Yeah, and definitely, like, if you're interested, Rachel, just you can start the process and we can discuss that as a staff to get back to you. All right, we have another question about, so saying for the practicum, we're required to submit the project goals and objectives, affiliate agreements prior to May 1st. Is that something that can be done, or do I have to wait until arrival to Nicaragua?
Okay. Oh, yeah. Okay. So, hi, I received my Master's of Public Health, and this seems like a Master's of Public Health student. So I understand that aspect. And so, yes, we will have the project goals and objectives already. Actually, we're pretty much finalizing them right now. So those will definitely be ready. And like I said, the project areas are going to be Zika prevention, chronic disease prevention. We'll have a women's empowerment that's going to be focused on nutrition this year, taking baseline nutrition surveys, and youth empowerment. And so we have those projects pretty defined.
Okay, it looks like we may have covered all the questions that you guys had in the chat. If anyone still has a question, or if I missed yours, I really apologize, but if I did, please feel free to chat it right now in the chat box before we close out. And I'll just wait 1 minute to see if we have any final questions from anybody. All right, not seeing any. So I'm gonna go ahead and just say a quick thank you again. Thank you, Sara, for being on the call with us.
You're welcome.
Much.
All right, so just to finish out then, we are going to say again, we'd love to have any of you who are on the call tonight. Thank you so much for taking the time to listen to us.
Yes,
and to ask such great questions. We do have limited slots this year for our internships. We only have between 12 and 16 slots for our internships. We have more openings for just the practicum part, but we really encourage you to apply to the program. Email Milvia at volunteer.coordinator@amoshealth.org.
And also, reach out with any questions that you have.
Yes, if you have any questions.
We're happy to always answer those questions, and we look forward to getting to know you guys.
Absolutely. And just one more time, thank you guys so much for taking the time to be here with us tonight. And we wish you really the best of luck. If you don't think this is the right program for you, or if you do, wherever you go and whatever kind of experience that you're looking for, we hope you have a great luck in your search.
Yes, thank you. Have a great night.
Have a great night, everybody.